It's like we've gone through conscription. That's exactly what it's like, except that there's no war.
A special legislation to impose a new compensation model for Quebec doctors and to put an end to their boycott on teaching medical students. The National Assembly in session on Friday to debate this legislation introduced by the Legault government. Referred to as Bill 2, it has many of the main principles of Bill 106, but also includes sanctions for those who negatively affect access to services or hinder the smooth running of the training process for healthcare professionals.
We've had a very clear vision for the past few years that we need to increase access. In order to be able to increase access for patients, healthcare professionals need to work together more effectively.
The special law also links a portion of a doctor's compensation to performance objectives. The doctors or group of doctors could now face fines of up to $500,000 per day for taking what are referred to as concerted actions. Fines could be doubled for a repeat offense. The FMSQ, the Federation representing medical specialists, say they will look at all of their legal options to contest the new legislation.
This is a very dark day. It's not only dark for the specialist doctors who are taking a beating, but it's dark for medicine in general and for the healthcare system. We are witnessing an authoritarian drift by the government, and I think you need to understand that clearly.
It has decided that it can tell us how to practice, where to practice, who to treat, who not to treat, how they're going to pay us, how they're going to penalize us. In fact, they're penalizing us before we even start.
This government is basing performance on how many patients I can see in an hour. Well, I'll be honest with you, I'm an emergency room physician. You want me to rush through 50, 60, 70, 80 patients in an hour? I can do it, but they're not going to be taken care of properly. Is that what the government really wants? What you see is an attempt by the government not to improve healthcare, but to pick a scapegoat.
Is this going to create an exodus of physicians? Absolutely. You may be looking at one of them right now.
This government constantly compares itself to Ontario, right, in terms of economics and this and that. Well, Ontario, instead of forcing their doctors, actually had binding arbitration. Now, everyone is not happy when you have binding arbitration, but at least it's fair, and you get an accord between the doctors and the government. And you have a much better healthcare system in Ontario than you have here in Quebec.
We are going to take every single legal mechanism at our disposal to contest this. We already have given the mandate to our lawyers, and they're already looking at how they're going to contest it, and in every possible way they will.
In Montreal, Gareth Madoc-Jones, City News.